The times, they are a-changin'. Could this be the decade of integrative medicine going mainstream? Join me, Dr. Bill Rutenberg, your host, and my guest, Dr. Brian Berman, at the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. Dr. Berman is a professor of family medicine and director of the Center for Integrative Medicine at the University of Maryland Medical Center in Baltimore, Maryland. Currently, he is the principal investigator of 2 NIH-designated centers for the study of traditional Chinese medicine. He was the first chair of the Consortium of Academic Health Centers for Integrative Medicine and served on the Institute of Medicine panel on complementary medicine. Dr. Berman co-founded and coordinates the complementary medicine field within the Cochrane collaboration. Today, we're discussing developing the evidence base of complementary alternative medicine and integrating it into daily practice. Hi, Dr. Berman. I appreciate you taking the time to join us at the Clinicians Roundtable.
Thanks very much. I'm glad to be here.
What can be more mainstream than an academic medical center? Dr. Berman, you were the first chair of the Consortium of Academic Health Centers for Integrative Medicine, which is composed of 29 North American universities. When and how did this group get formed?
The Consortium of Academic Health Centers for Integrative Medicine first started to get together as a small group of people from 6 universities, and then it became 7 universities, back in 2000. It became more formalized in 2001. And it was really the brainchild of a fellow at the University of Massachusetts at the time, John Kabat-Zinn, who said, started to realize that a number of universities were starting to do some serious work in the field of, I think back then, complementary alternative medicine. And really, what could we do collectively? How could we support each other? How could we get, the deans and the presidents to understand what this was all about? And so we started to have some meetings. It's actually grown to now we have 41. We said back then, I remember when we were meeting at the Fetzer Institute in Kalamazoo, Michigan, we were having our first meeting, and at night we said, wouldn't it be amazing? We really know this is on the way. When if we could get about a third of the medical schools in the country to be involved with this. And just recently, we accepted the 41st university as part of this.
41 universities gives you about how many members? I assume there's more than one representative per school?
Yeah, there's generally 3 or 4 members per school. So, I don't know, that's, 150 or so people involved with it right now. And they're focusing on all areas, but particularly, one was to just get a definition of what integrative medicine was about, because, really it was not about, an alternative therapy. It was really kind of coming up with the idea that it was just about good whole person care. In a way, the essence of an approach to care, there was like a holistic approach. One of the most important parts was about the relationship between the doctor and the patient, and that we looked at, the whole person and then used, based on evidence, whatever therapies were the most appropriate to use to optimize health and healing. So one part was just to get a definition, and then they started to work together on educational activities, because everybody in the academic centers was certainly going to be involved with education and trying to move things forward, and published in a couple of things. One was in Academic Medicine, the journal from the American Association of Medical Colleges.
Yes.
October of 2007 was an issue that was mainly devoted to curricula and integrative medicine in some of the medical schools that the NIH had supported some of their efforts and their experiences and, what they were doing. And also, I think it was 2005 in the same journal, Academic Medicine, also published from the group, what would be some of the curriculum, what would be some of the key ingredients to have if people were wanting to include this in the school. Everybody's going to do it differently.
What might be, say, the 5 key elements to a curriculum in complementary medicine? Or if you just wanted to begin to expose people to it, and you said, here are, some take-home points, we've got to have this in our system in our school.
Well, certainly one is more of an overview, of some of the different therapies, so people could have a better understanding of what you mean by mind-body medicine or traditional Chinese medicine or Ayurvedic medicine, just, on the therapy side. That was certainly one part. So there was more about the knowledge, but probably the bigger shift was really about the sort of mind-body skills and teaching to the students ways that they could be more in touch with who they were. That was one of the key elements. And, we all talk about, in the curriculum now, the core competencies, we want it to be things like, besides, having your knowledge and skills base, but who is the doctor? Who are we really training? And how do you do that? How do you build in altruism or empathy and listening, and you don't do it by a PowerPoint presentation. You do it by some of the tools, I think, that integrative medicine have to offer, like mindfulness meditation or yoga or some of the self-reflective practices or breathing, things like that. So there's a real opportunity there to sort of make a shift in the medical education. We kind of think, why would we even do it? Why incorporate any of this? And what we know from the research is more than 50% of people in our country are using some form of complementary alternative medicine from the research. And yet a very small percent are actually telling their doctors this is what they're doing.
Yeah, I mean, the numbers using it are tremendous. I saw something not too long ago about somewhere between the third and fourth year of medical school that medical students are losing their ability to empathize with their patients. That was horrifying to me. Are you currently using a curriculum in complementary medicine or integrative medicine at the University of Maryland?
We are. We introduced this, when we got started. We started our center back in 1991. So we've been experimenting and trying to progress in different ways. So we have quite a number of hours in the core medical school education, and we also have a 1-month elective for those in the fourth year who want to go into it in a little more depth. But we're really just, in some ways, just scratching the surface. What's that study that said that, we as physicians, in primary care, we wait, I think, 18 seconds before we interrupt.
Yes.
And then I think over a few years later, they redid that survey and they found it was now 22 seconds. So we're improving.
We're improving. I'd like to welcome those who are just joining us at the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm Dr. Bill Rutenberg, and I'm speaking with Dr. Brian Berman from the University of Maryland Medical Center. We're discussing CAM, integrative medicine, and mainstream American medicine for the next decade. The curriculum, did they get any practical experience? I mean, do you let them get acupunctured, or do you train meditation? Do you give them real?
We do. We think that, and that was part of just the learning. In the beginning, we were more didactic, and we also, because we, do a lot with literature synthesis and critical appraisal, we teach them, ways that they can find the literature themselves. And that's not so easy in this field. I mean, I don't know if we're aware, we didn't have a lot of the mesh terms or the search terms until like the mid-90s. And in the early days when we got started, you wanted to plug in to see, okay, what's out on Medline. You would type in, let's say, complementary medicine, nothing would show up. Integrative medicine, nothing would show up. Alternative medicine, nothing would show up. What you had to type in was therapeutic cults.
Therapeutic cult?
That's what it was listed as.
Oh.
So we've gone a long ways. In the Cochrane database, there's over 10,000 trials. And we try to teach the students how to fish for themselves, how to, really find the information themselves. But we also, we do teach them about, breathing techniques, let them experience that, and meditation, mindfulness meditation, and, that's what they're interested in more than anything, is to actually see and feel and touch. And so we do a little bit of that.
Your work with the Cochrane collaboration, when I looked on your website, there are over 200 reviews, it looked like, that are in the Cochrane database at this point?
That's right, in CAM.
In CAM, right. Are there any practical pointers? Our audience is primarily primary care physicians. And if I wanted to take an evidence-based approach and tell my patients, for some specific conditions, here are things that there's evidence for, I feel I can endorse this, go home and do it.
Right. There are actually, quite a few.
Like big problems. I mean, headache is probably a huge problem. Irritable bowel syndrome I can think of, and maybe pain. Are there a couple of recommendations you can make in those areas?
Sure. Well, with headaches, there are some systematic reviews showing evidence for acupuncture for chronic headaches.
Any experience with feverfew being used?
Feverfew, I'm not sure if feverfew in itself, was a systematic review. But certainly plenty of others. Back pain, the systematic review showing some benefits from manipulation, from massage, for acupuncture, for TENS. There's, a bunch there with that. Glucosamine, chondroitin sulfate for osteoarthritis, some of the herbal medicines for things like dysmenorrhea, as well as devil's claw for arthritis. Saw palmetto for prostate hypertrophy. Yeah. So there's actually more evidence, and people can go to the website. They can, look at it themselves, because it's actually surprising how much evidence there is. And we did a study years ago where we looked at, in the Cochrane database and we looked at systematic reviews of conventional medicine that was in there.
Okay.
And we kind of said, okay, what conclusions could we make? And we saw a positive effect in about 1/4 of the reviews, possible effect in about another 12%, and then insufficient and conclusive evidence in over half of the reviews.
And that's considered mainstream medicine.
This is the mainstream medicine. And we looked at it. We haven't done the same thing for complementary medicine, but I'll bet we'll find fairly similar sort of statistics. Medicine is, a lot of it is an art. We talk about evidence-based medicine, and evidence-based practice. We maybe should be talking about practice-based evidence. So it's really relevant to our clinical situations, but, it's an evolving field.
I find Jerome Groopman, I don't know if you're familiar with him, Dr. Groopman.
Yeah.
In his recent book, he has a statement that a doctor will frequently tell a patient, well, there's no evidence of disease, but that doesn't mean that there's evidence of no disease.
Right.
And, that's a big difference. It's a big shift.
That's right.
And the fact that they just figured out that if you witness somebody having cardiac arrest, that you don't breathe for them, just pump. And
right.
How many years has, quote, the evidence been breathe and pump, breathe and pump? So
it's evolving.
Yes.
It's evolving. And we shouldn't think that it's like rigid, this is fixed once and for all, we know everything. We should be, keeping at it. What we do know in this field of complementary medicine, integrative medicine, that there are many people using it all the time. And, we should try to educate ourselves as physicians to know as much as possible with time, what's the latest evidence, but realize that it's an evolving field. In our overall, there's over 700 meta-analysis systematic reviews. Each one may have like 10 randomized controlled trials, and that's just one part of evidence. There's certainly lots of other evidence that always takes into account when you're looking at, does something work?
We have just a little bit of time left. You'd mentioned that the Cochrane database was available through your website. Could you give us the website address and tell the audience how they would be able to access the database?
Yeah, sure. They would just go to www.compmed, COMPMED.UMM, that's University of Maryland Medicine, .edu. And then once you get there, you'll see the face page, and you'll see a little thing for Cochrane. And you go right to that, and then you can get into some of the information there.
I'd like to thank Dr. Brian Berman, who's been my guest, and we've been discussing making complementary alternative medicine mainstream. I'm Dr. Bill Rutenberg. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. We welcome your comments and questions. Please visit us at reachmd.com and explore our on-demand and podcast features, which gives you access to our entire program library. Until next time, I wish you good day and good health.